Yeah, good day everyone. My name is Ibrahim Hamid Oluki. I'm here to take you NSC 312 Medical Surgical Nursing Practicum 2. Now, this is my course overview. So, Medical Surgical Nursing Practicum 2 is designed to provide student nurses with hands-on clinical experience in a variety of medical surgical settings. This course integrates theoretical knowledge with practical applications, allowing students to develop critical nursing skills essential for the care of adult patients with diverse health condition. Now, these are my course objectives. At the end of this course, you should be able to assist or carry out procedures such as wound dressing, client feeding, catheterization, bed baths, and many others. You should be able to develop nursing care plans for clients or patients, implement them, write relevant reports on care of clients or patients, to present reports on completions of postings as necessary. Now, I'll go by the introduction now. The purpose of Medical Surgical Nursing Practicum 2 is to advance the clinical competencies necessary for efficient patient care in a variety of medical surgical settings, while also strengthening the fundamental nursing abilities. This course fosters critical thinking and clinical judgment in real-world circumstances by emphasizing the integrations of theoretical knowledge with practical practices. Now, I would like to introduce you. Before you can get to the word, you need to be very conversant on what aseptic techniques and sterile techniques is all about, so that this will prevent you in infecting yourself and also infecting the patients. Now, aseptic techniques and sterile techniques are very critical, very important in practicing in healthcare. This aims at preventing infections and maintaining the safety of patients undergoing any procedure, is that medical procedure or surgical procedures. Now, what does aseptic techniques mean? From the word aseptic techniques, it involves practices. There are practices, what you are doing, is that with your hand or anything, with your hand, your body, your mind, that reduce the risk of infections by maintaining a clean environment and minimizing the presence of pathogens. It includes proper hand hygiene, hand washing, is that before a procedure or after a procedure. Also, using of personal protective equipment. Before you attend to any patient, the way you put on, you wear your face mask, you wear your boots, you wear your gown, could be a surgical gown, could be apron, your cap, your goggle. All these are called personal protective equipment, and careful handling of instruments and materials. The Centers for Disease Control and Prevention emphasizes that effective aseptic techniques is essential in various healthcare settings. Now, what are the principles of aseptic techniques? Number one, as it was said earlier on, hand hygiene. Thorough hand washings done under your running water, or sanitizing your hands before and after contact to patients is very important. This is done to eliminate any kind of pathogens in your hands. No matter how you think your hand is clean, you have to you have to perform any hand hygiene. The use of PPE, as it was said earlier on, these are PPE, wearing of gloves, surgical gloves, masks, gowns, high protections, goggles, and like that. Now, environmental control, you have to put a caution, don't pass here, don't enter here. Put it there. Environmental control keeps the environment clean. No, they should not litter the grounds. All this is just to ensure that there is no cross infections. Now, sterile techniques. The word sterile techniques, on the other hand, is more stringent practice designed to maintain a sterile fit, particularly during surgical procedures or during any kind of invasive interventions. What you call invasive, you are going to patient's blood, you are making incisions. So these techniques require the complete eliminations of all microorganisms like bacteria, viruses, spores from instruments or any surfaces. Now, what are the components of sterile techniques? There's something called sterile feed, establishing a sterile area using a sterile drapes to cover sterile drapes in covering or preventing contamination. If you have a patient on the operating table now, there's something called sterile drape. When they use the drape when they clean the patient, they use the drape to cover the patient. You are already establishing a sterile area. Now, sterilization of instruments. You have to ensure that all surgical instruments undergo sterilization. There are different types of sterilization means. you can autoclave them, or chemical sterilant. Also, proper handling of sterile items. This is very important. Usually because you just sterilize an instrument now, you now handle it in an unsterile manner or unsterile way. Note it, it has rendered that instrument unsterile. You should be very cognizant of that. Now, instruction of students to students in the surgical or medical wards. In the surgical ward, all student nurses encounter patients undergoing various surgical procedures requiring a comprehensive understanding of perioperative and postoperative care. You need to know what are the things that is expected of you to do preoperatively, like counseling your patients, gaining of consent forms, shaping of patients, nothing per hora, as in the patient should not take anything before the surgery. Everything, you should be conversant with it. Checking of vital signs, pain, you manage your patient pain, manage their anxieties, and like that. And also, remember, you cannot work alone. It requires a multidisciplinary team. Now, integration continues. Conversely, medical wards cover a diverse array of cases involving acute and chronic conditions. The student nurses in these settings develop skills in patient assessment. You need to assess your patient. You need to know how to administer your patient medications and how to manage some of these chronic diseases or ailments. They also gain valuable insights into the emotional and psychological aspects of patient care. You should know when your patient is having some one or two kind of disease. Don't just see, that's what you have took yourself into. No. Psychologically, you should know how to control your patient, to manage your patient emotionally. Now, my conclusion. The introductions of student nurses to medical and surgical wards is a very vital component of their educational journey. There's no way as a medical surgical nurses that you don't deal with these two main areas, providing essential opportunities for practical applications of nursing theories and development of critical clinical skills. This immersive experience enables students to engage directly with patients, fostering a deeper understanding of patient care, teamwork, and the complexities of various medical and surgical conditions. I would like to stop here now. I believe my class is interactive, and you are very free to ask me questions. If you don't understand any area, drop a message for me on my mail on the comment box. As it was rightly said, my name is Ibrahim Oreloke. I'm happy to see you today. See you in the next class. Thank you, and God bless you.